All right, we're going to cover Chapter 3, Lifting and Moving Patients. So with that said, we're going to talk about protecting yourself as well as some body mechanics. There's some really good information about different types of lifts and drags and carries that will need to be utilized. So make sure you take good notes on those. First thing we're going to talk about body mechanics. Obviously, the proper use of your body to prevent injury and to facilitate lifting and moving. So the biggest thing is to concentrate on proper lifting techniques, working on stretching before your shift or something along those lines to decrease the chance of you being injured. One of the most common injuries to end your EMS career is going to be back or shoulder injuries. So keeping your body in shape and preparing for the job is going to be extremely important. Before you're going to lift any object, you're obviously going to take a look at a couple different things. The first thing you're going to take a look is the object. Try to determine the weight and whether or not you're going to need extra help before you lift. So if you look at an object and deem that it's going to be over a couple 100 pounds and you feel like you're going to need additional assistance, then utilizing additional resources or adding additional units in. The other one to think about, obviously, is knowing your limitations and communicate with your partner. Make sure you have a plan-oriented. Make sure that you know if you're going to if you're going to lift in the count of 3, or if you're just going to lift. Make sure both of you and your partner know: are you going to go up or are you going to go down? And obviously, if you're going to go left or if you're going to go right. Rules for lifting: position your feet properly, should be about shoulder width apart. You're going to use your legs and not lift with your back. You should never turn or twist when lifting, and then don't try to compensate with one hand to the other. If you're using one hand, don't try to compensate by bending to one side or something along those lines. Rules for lifting: keep the weight as close as possible to your body. It's going to be really, really important when it comes to keeping your center of balance squared away. If you're utilizing the stair chair, make sure that you have adequate enough resources. This does take 2 people to lift and a 3rd person to spot you. Those stair chairs, I believe there's some pictures here coming up. Those stair chairs are utilized when you have a conscious patient without a spinal injury that you're required to move up and down the stairs to get them out of a house. Notice how this is in red, so anything in red, pay very close attention to, as they'll be very important topics. Here's that stair chair I was talking about. Again, patient needs to be conscious, as well as needs to not have a spinal injury. As you can see, you have one person here holding the top, one person holding the bottom. Both of these people have their backs nice and straight, their arms are locked, and they're keeping that weight as close to the body as possible. This 3rd person is utilized to spot so you can safely move up and down the stairs. This is the power lift and power grip. Power lift is the body mechanics that you're going to use. Power grip is defined as your hands 10 inches apart and your palms facing outward. Keep your back locked in and lift with your legs. When you're reaching, this is a pretty common occurrence, so just kind of keeping yourself safe to make sure you're not injuring yourself. Keep your back in a nice locked-in position. If you can, try to avoid twisting while reaching. Keep things in the front of your body. Avoid reaching more than 20 inches in front of the body. That way you're not leaning too far forward. And then if you can, try to avoid any prolonged reaching with lots of strenuous effort. This is pretty important. We try to follow this as much as we can. When pushing or pulling, you should push rather than pull if at all possible. Just helps with body mechanics just a little bit. Keep your back nice and locked in. Keep the line of pull through the center of your body. So make sure you keep that stuff nice and close. And we talked about keeping that weight as close to your body. This one is a little bit confusing sometimes. If the weight is below your waist, you should push or pull from a kneeling position. If you can compensate for that and keep your body nice and stable, that's great. We all know kneeling down in EMS can be a little bit troublesome, as we're concerned about getting blood or bloodborne pathogens onto our uniforms. So just utilize this whenever it's absolutely necessary. Avoid pushing or pulling over your head. Obviously extremely dangerous to have weight or objects above your head. Keep your elbows nice and bent and your arms close to your sides. So we're going to talk about the 3 types of moves. This will be important information. You'll see lots of test questions related to this as we move on down the road. So make sure that we take good notes and understand these topics. So the first one is emergency moves. Emergency moves are going to be utilized for any time the scene is hazardous. There's something in the scene that is dangerous to you. If you're removing someone from a house fire, if you're removing something from a car because there's a gas leak or some sort of fuel spill. The second reason would be you need to move them to care for life-threatening conditions that requires repositioning. Most common one that we talk about is with cardiac arrest. If you find a patient in an unsafe area or an area that you can't work and do your job, so if it's in a small space or on a bed or something along those lines, we're going to go ahead and move those patients using an emergency move. And the other one that's commonly forgotten is you can utilize the emergency move to reach other patients who are more critical. Best example for that is you had 2-person automobile collision. You have a driver and a passenger. The passenger is the most critical patient, but you're unable to gain access to the car from the passenger side. You would utilize an emergency move on the driver to remove that person to then reach the passenger. When we're talking about emergency move, there's some pictures coming up that's going to talk about that. The biggest thing is with emergency moves, you don't take any additional precautions to maintain spinal immobilization. So you just move them without holding their neck stable. You do try to pull them along the long axis of their body to not cause more damage, but you don't take extra precautions to maintain that spinal immobilization. Couple of ones coming up. This is the clothing drag or the clothes drag. This one's a little bit of an issue sometimes because clothes can tear. You can utilize dragging a patient by their arms if needed or by their shoulders. But this is the clothes drag. This is the incline drag, so slightly inclined. This one can provide some bad body posture. So just make sure that you stay nice and safe when it comes to your back nice and straight. The other one is the more body that's in contact with the ground, the more friction you have, that's going to obviously cause you to have more friction on the ground. So therefore, it's going to cause more drag or more issues when it comes to pulling. So making sure that you have as little of the ground, or little as the patient, sorry about that, little as the patient in contact with the ground as possible. This is the firefighter's drag. As you can see, this one seems a little bit on the awkward side, but notice how you've got the patient's hands tied. This allows you to move using your 4 extremities. We've seen this utilized in the tactical setting with law enforcement as well as firefighters. If the patient has if they're in a house where there's smoke inhalation or something along those lines, then this would be what would be considered the preferred method, just so you can drag them properly. This right here would be the blanket drag. Again, this helps with movements and things along those lines. Again, it allows you to be in a lower position. It keeps your back nice and straight. Utilize a durable blanket, obviously, to keep them from being injured more. This is the one rescuer assist. In this circumstance, the patient clearly has to be conscious. This is usually utilized for patients with extremity fractures that can't walk on their own or something along those lines. So this keeps this moving along. This is the 2 rescuer assist, pretty similar to the first one, just providing 2 people to help carry. This obviously provides a little bit of trouble if patients or providers are different heights, so kind of keep that in mind as well. On to urgent moves. This is going to be the times that the required treatment can be performed only if the patient is moved, just like before. But this one is the fact that the biggest thing is we're going to move this patient, but we're going to provide spinal immobilization. So moving a patient onto a long spine board from a car, or moving a patient out of an area that might be deemed to be unsafe or something along those lines. But these patients are not critical enough that we need to have the emergency move. So the urgent move is just going to be that move from most commonly a car to a backboard. Some pictures coming up talking about those, and we'll talk about when to utilize that. We're going to cover backboards and spinal immobilization much more in depth when we get into spinal emergencies. Rapid extrication is the best way that we utilize this. What we're talking about is moving a patient from a car onto a short backboard or some sort of vest style device. We're going to talk about that, and I'll show you what that looks like here in a second. Obviously, you want to stabilize the spinal cord so you don't cause any more injury. The last one that we're going to talk about is the non-urgent moves. This is where your patient is stable. There's no life threats. You can assess them, treat them, and move them in a completely and totally normal way. And you're going to take all precautions that you possibly can not to aggravate any existing conditions. So this is the one that you're going to provide full spinal immobilization inside of a vehicle. And then you're going to worry about moving them out. I'm going to talk about the Kendrick extrication device, or the KED, here very shortly. And that's going to be the device you're going to utilize to work with this. Different styles or different types of patient carrying devices. There's some pictures to go along with these. A couple different types of stretchers. There's power stretchers that utilize batteries to help with lifting. There's the manual stretchers, obviously manual meaning that all the work and lifting is done by the providers. And then there's some bariatric stretchers. We got a picture of those here in a second that talks about patients who are over about 800 pounds and utilizing safety precautions to keep us safe as well. This is a wheeled stretcher. This one just happens to be a power stretcher. If you look right here, you can see that it's got a battery pack, and this device is controlled by some push buttons that are found right here underneath his hands. It makes the stretcher go up and down. The trouble with these is they tend to weigh more than the manual stretchers, so for some reason if you do have to carry them, it tends to be a little bit heavier. The stretchers that we utilize now are technically considered to be 1.5-man stretchers. By that we mean that it takes 1.5 people to lift and load this stretcher. The way this is going to work is this stretcher is going to latch. This bar right here, you will see, will latch onto this, and then the person back here will lift and take the weight off the wheels. He'll push the button to bring the wheels up, and then you can go ahead and load that. You do have to utilize this person to guide this in, and that's that half position. They don't consider it to be a full position. This is just another look at a power stretcher. There's some advancements in these, some that self-load, some that move and somewhat different. If you want to research those and find those out, Furno, right down here, if you just Google Furno, you can look at the different products and kind of understand the different types of stretchers. Bariatric stretchers. So this one's got a couple unique features. One, the stretcher is meant to stay low to the ground at all times. It doesn't move up and down like our traditional stretchers. So with that, you've got to have these bars right here that allows our providers to push and to pull this without changing their body position. The stretcher is also wider to compensate for that weight and the size of the patients that we're loading. And then as you can see, it does come with ramps that allow these patients to be loaded without any lifting. Inside this ambulance, what's really hard to see is there's actually a winch cable that runs like this, and it runs inside the ambulance, and that winch provides the pulling to decrease the amount of dangers or damage that can be done to the providers. A couple other different devices, stair chairs, which we've talked about. There's a picture coming up. These are useful where stretchers cannot be easily maneuvered. The biggest thing to remember with this is if your patient is unconscious or your patient has a spinal injury, you cannot utilize the stair chair. You're going to have to utilize the KED or a backboard or something along those lines. Spine boards, short spine boards, I got some pictures of those coming up as well. Not really utilized very often, but can be used for patients pulling them out of vehicles and stuff along those lines. We've pretty much replaced those short spine boards with the Kendrick extrication device, which we'll talk about. The best thing to remember with those is that's the non-emergent moves, so those patients are not meant to be critical. Picture here of the stair chair. You can see a couple of features. One, it's got these handles here. They actually extend out to provide a little bit change of position for you as the lifter. It's got some seat belts here and some seat belts down here that actually buckle up and over the patient. Again, it also has these handles right here, flip up and give some stability there. Some of these also have traction tracks that allow these to slide down the front of stairs. I'll go back here real quick to the stair chair picture. and you look at that and see if there was tracks on this one. It doesn't appear to be, but there's actually tracks that allow them to slide down the front of stretchers along these lines, which would allow that to provide some help when it comes to lifting those patients. These are your long spine boards. These are utilized for patients with spinal injuries. Some people fit on these quite nicely. Some people you got to provide some padding. Also with these, there's a couple different styles. Some have these bars right here that are meant to have buckles that actually clip. Some of these don't. If you notice, these ones don't have down here do not have the metal bars in the middle. These are meant for what's called spider straps, which are Velcro straps, also utilized. Every agency is a little bit different, so know your agency's protocols and so on. We get into spinal immobilization, and then when we get into skills, you'll get a chance to have some hands-on on those. Other types of stretchers, most of these have pictures as well. Portable stretchers, scoop stretchers, basket stretchers. We're going to talk about each one of these individually. This next one is the patient immobilizing device known as the KED, or the Kendrick extrication device. This is the vest style. So this goes on, you're looking at the back of this. The patient would go on the opposite side. These green, yellow, and red buckles go across the chest. These two buckles actually go along their legs and hips, kind of similar to a climbing harness. These two straps right here immobilize the head, and this is some padding to be utilized behind the back of the head or neck if it's needed. Get a chance to go over this much more with skills in spinal immobilization. This is a scoop stretcher, or the orthopedic stretcher. This actually disconnects down here at one end that allows this to actually be opened up and scooped underneath a patient. This provides us to be able to move our patients just in case they have a hip fracture where we don't want to roll them. The orthopedic stretcher is utilized for that. This is a basket stretcher. This is predominantly used during technical rescues or rope rescues. Your backboard or a patient would go right inside here with these straps, and then you can utilize these areas to actually run ropes and so on. So you can obviously be able to rappel or something along those lines with this, so that you can safely get your patients out of some of those backcountry rural areas. This is called a back saver. This is like a flexible stretcher. This is the back saver, and this would be the flexible stretcher over here. With the back saver, the one thing that's nice about these, a lot of us here in Spokane County area have these on our stretchers. Our patients lay on them, and then what happens is when we use this device to move them to a bed, this middle piece right here comes out of the middle, and this comes apart in two pieces. So we don't have to roll them one side or the other to help them get off of that device. So this is, we just called it a back saver. Another thing that you can look up on Google, and there's lots of pictures for those. This is a vacuum mattress, utilizes this pump right here that sucks the air out of this device, and it kind of turns to a hard styrofoam. It rolls up into a small area, so it doesn't take up as much space in our compartments. Some agencies have these, some agencies don't. Just going to depend on what agency you work with, whether or not you get familiar with this device. This is just them inflating that. Or deflating that for that case. A couple different things with this: moving patients onto carrying devices. If you believe they have a suspected spinal injury, then you're going to be required to immobilize the head, the neck, and the spine before you move that patient. While you're doing that, someone's going to hold what's called manual stabilization. Someone sitting on the head is going to put one hand on one side of the patient's head and one hand on the other, and that's going to provide that manual stabilization. And then utilizing a rigid cervical collar, or a C collar, to continue with that. You have to maintain manual stabilization, even if you're using a C collar, all the way to the point where they're fully immobilized to a spine board or in that Kendrick extrication device. Like I said, we're going to dive much deeper into spinal injuries once we get a little bit farther into the traumatic chapters. Patients without suspected spinal injuries, a couple different lifts and carries. One of the ones is the extremity lift. This is going to be provided to use to carry patients from a stretcher or a stair chair, all the way to patients who might be taken from a wheelchair or any sort of seated position and moving them to the ground or to the stretcher. This next picture is going to kind of look at that. Again, this is the best way to utilize those patients. Patients without suspected spinal injuries, a couple additional things. Direct ground lift is lifting from the ground to the stretcher. Best way is to look at the pictures coming up. This obviously, your back position's a little bit poor in this case, so make sure the weight of your patient is on the low side. You're going to lift this patient up, and then you're going to place them on the stretcher. Again, two people can easily lift, 110 pounds, 130 pounds. But if we're talking about a couple 100-pound patient, then this lift may not be the best thing when it comes to safety. Also, draw sheet method, direct carry method. The draw sheet method, I'm going to the next picture. This is utilized a lot from going from either a patient's bed to our stretcher or our stretcher to another bed. As you can see, you just roll up this blanket right here along this side so you can get a good grip. It's better if you have one or two people over here on this side as well. That way they can keep the patient from falling when this is getting close to this end. But you're just going to utilize that sheet to drag that patient over and place them on your stretcher. Going to talk about a couple positions here real quick. The biggest one we're going to talk about is the recovery position. This position, as you can see, this is on the left-hand side of the patient. This is called the left lateral recumbent position. This position is best for patients who are experiencing nausea or vomiting. It's also very good for patients who are unconscious without a spinal injury. This allows them to control their own airway. If this patient vomits, it allows that vomit or blood to remove itself from the mouth, decreasing the chance that we cause any airway problems. One of the bigger changes we've seen the last couple of years is our positioning for shock. For shock, our patients should be laid in the supine position, which means flat on their back. We no longer lower their head and we no longer raise their legs. So we just utilize the supine position for shock. If you've taken EMT before, or you've heard other people talk about the Trendelenburg position, which was the feet were elevated, we no longer use that to treat for shock. Transferring the patient to a hospital stretcher when you arrive, the best way, we're going to go to these pictures, the best way is the draw sheet method. Place your stretcher right next to the bed. This is going to utilize about 4 people. Utilize the blanket or a back saver or whatever they're on. Again, these people over here on this side, just make sure that they are in good position for lifting mechanics, so that way there's no problems. And as you can see, you just lift right over. Now, once you make that transition over to this side, make sure us as EMS providers, our backs are nice and straight. And then there's going to be a continuation of care or handoff to the hospital staff, which we'll talk about a little bit more. That's pretty much it. We're going to do a really quick review of this. Couple things to remind yourself. The process of lifting and moving requires you to communicate and make sure you pay close attention to body mechanics so you prevent any injuries that could possibly be done to yourself. The most important thing to remember is make sure you lift with your legs and not your back. You want to have a real long career in EMS, so make sure you keep yourself as safe as possible. Really review the fact that there's emergency moves, there's urgent moves, and there's non-urgent moves. Emergency moves, we do our best to not aggravate spinal injuries, but we don't take any additional precautions to prevent those. Urgent moves is going to be where we're going to prevent or take those precautions to prevent that spinal injuries. And then the non-urgent moves, we're going to take all precautions that are absolutely possible to utilize or to make sure we don't cause any additional spinal injury. Protect yourself. Again, protect your patient. We don't want to drop people, so make sure everyone's safe. Make sure they have a positive EMS experience, and make sure you have a long and positive EMS career. Proper lifting technique is extremely important, so make sure you request additional resources. We always have the saying, don't be a hero. Don't think that you can carry more than you can. Utilize additional resources to help you from getting hurt. One of the things you're going to have to choose is the correct device based on whatever patient or patient position those are in. So make sure you familiarize yourself with those different devices and what they're utilized for. Again, we go back to make sure you have proper technique to move patients onto the patient carrying devices, and really make sure that you don't cause any injury to yourself or to your patients. That pretty much takes care of Chapter 3. If you got any questions, you can go ahead and email those to me. Hope you enjoyed the lecture.